Institute in Germany. We are the Federal Institute for Vaccines and Biomedicines. We are number one in the regulation of biomedicines at the EMA level in Europe. We also host a control laboratory, and we take care of the healthcare system from the regulatory side. We dedicate also a lot of work to WHO and to Africa. Let me start by repeating that our founding director was Paul Ehrlich, and he was actually the first one to standardize medicines. He invented an assay that could distinguish, in the old days in 1896, between diphtheria sera that would rescue and cure children from a deadly disease, and he could distinguish the good anti-sera batches from bad ones that were not able to do the job and were non-efficacious. So if you want so, he was the first one to introduce experimental testing into regulations, and I think we can still use experimental testing today to improve the situation. How can we really help each other and limit the amount of substandard medicines in the world? I think one of the answers and message one is good regulatory governance, building networks of medicines agencies, control laboratories, and centers of knowledge and excellence that provide support to a network. And let me just repeat what others have said, but we have rules and messages and standards that are installed in guidelines and reference material from the WHO. There's inspection and good manufacturing practice that has to be done before manufacturing starts and routinely afterwards. There's rigorous benefit-risk assessment to have good licensed medicines on the market, and samples can be seized and controlled and tested to make sure that no falsified medicines are on the market, or at least reduce the risk. The distribution chains that we all suffer from when falsified medicines are introduced, they can be controlled by good distribution practices, and samples of biological medicines can be tested by official control laboratories before they are marketed. And this is what Paul Ehrlich Institute and your control laboratories do and still have to do in the future. How does WHO contribute? Well, WHO provides us with a great set of rules and standards and provides global support. It's the Expert Committee of Biological Standardization that I had the pleasure of chairing during the last 2 years that helps a lot, that installs reference material, that forms guidelines and standards that help us all. Of course, using WHO global surveillance and monitoring system is of utmost importance, but what each African government can also do is to assure sustained regulatory systems. And with sustained systems, what I mean is we have all, and you have all, invested a lot in educating excellent experts that have to gain experience on the long run. And you have to see to it that this personnel is kept and can gain further experience and is not constantly changed. We have to invest in that. I would like to also tell you that the Paul Ehrlich Institute, with support of the German Federal Ministry of Health, is engaged in 2 programs that train personnel in Africa. We learn from you and you learn from us. It's the VacTrain program that helps to introduce clear clinical trial regulations once epidemics come along and vaccines have to be tested in clinical trials. And we have installed a blood train project that should allow access to blood and blood products in Africa, but because they're desperately needed. The second message is form a network of regulators throughout Africa. I know that everybody is, of course, hosting regulatory agencies with a lot of excellence, but you have to trust each other, rely on each other, rely on the better experience of other countries, bring in your better experience where you have it. And I think there you can learn maybe from the European experience, where we have done that, and we have built up a network of agencies regulating medicinal products and medical products in Europe, coordinated by the European Medicines Agency. Rely on each other, concentrate on the excellence that single agencies have, build a network that needs coordination, of course, but that is funded on the excellence and on the experience of member state agencies in Africa. Let us all put our knowledge together and experience, and the world needs good medicines and healthy people, and we should strain to make it a better place. Thank you.